Jyothi Raghuram, a senior pediatrician here at Aster Women and Children's Hospital, Whitefield. As pediatricians, we do see children mostly for illnesses or for routine visits for immunization. But many times we do have parents bringing their children to us with concerns other than these. For example, many parents want to know whether their child has a learning disability. So when should you suspect a learning disability in your child? These are not easily brought to parents' attention, or they come to notice sometimes much later, because the child may be normal in other parts of life, in other phases, or he may not be abnormal in any way. He may have a normal IQ, he may have a normal neurological development and still have some difficulties in school, leading to a poor scholastic performance. And that is when these issues actually come to light. So if your child has any issues with learning, if you feel that the school performance is below par, below average, then definitely this needs to be looked at. So why should you bring the child to a pediatrician? For one, because we need to rule out any other conditions that may be the cause of a poor scholastic performance. There may be neurological conditions, there may be non-neurological conditions such as malnutrition, there may be vision and hearing problems, there may be emotional issues in the child or at home, there may be a conflict in the parents, there may be school absenteeism, bullying by peers, and many other things such as exposure to gadgets and just not spending enough time. So all these can lead to a poor scholastic performance. But although the IQ may be normal, the child may have a specific learning disability in the form of either verbal or non-verbal disability. Verbal disabilities are more common, and this is what is seen as dyslexia or dysgraphia or dyscalculia. Remember the movie Tare Zameen Par? So your child or any child with a learning disability may be similar. By dyslexia, we mean a reading difficulty. The child may not have fluency in reading. The child may not be able to read properly or may read words from back to front. Dyscalculia means a difficulty in solving mathematics problems, in understanding numerals. And dysgraphia means a difficulty in writing. The child may mistake or interchange B for D, P for Q, C for 3. These kind of issues may be there, or may write entire words backwards. So non-verbal learning disabilities means where a child is not able to pick up non-verbal cues such as expression or any other body language. Child is not able to understand this. It may also be seen in the form of poor coordination, hand-eye coordination, or just clumsiness, what we refer to as a stupid child or a clumsy child. So these may actually be a learning disability which is not picked up. If you notice any of these issues in your child or anyone you know, if you have any concerns, then do bring the child to your pediatrician, who will rule out that there are no other causes for this. And if it is purely a learning disability with normal IQ, then the child will benefit from a visit to a child psychologist and also a remedial educator. We at Aster Women and Children's Hospital, Whitefield, are equipped with a team to address these issues and will be happy to be of help. Thank you.